Okay, signs and symptoms of the flu include fever, malaise. Malaise is like feeling drained, feeling like you have no energy, weak. Headache and myalgia. Myalgia is muscle pain or aches, more of an ache, muscle aches. However, you may have all or just some of these symptoms. Um, I guess fever is a sign, and you may not have all of them. And so, in general, they're pretty vague symptoms. And a lot of diseases have what we call flu-like symptoms because there's other diseases that have the same types of things. So by themselves, they're not that definitive. But if the doctor knows the flu is going around, then he may just say, go home and rest. They may run a flu test, some kind of serologic test, like some kind of swab, and then a dipstick, and you can run a serologic test to see if it shows up positive for flu. But even if it does, there's not much they can do for you. There aren't many antivirals, and the ones that do exist have to be given really early in order to have any chance of being effective. And you'll recall, virus just replicates so quickly that by the time you start having these symptoms, you've probably passed the point where any antiviral drug is going to be very much use. So they don't tend to do it. And if your immune system is healthy and normal, there's not a huge risk. Now, if you're somebody who has heart problems or some other kind of underlying health issue, then they would take it. The doctor would probably make some other decisions. But if you're healthy, a lot of times they're going to send you home, rest, you know, um, and you should feel better. Um, the incubation period is pretty short. The virus multiplies in the epithelial lining of your lungs, and it does kill those cells as a part of the virus progression. And so that can lead to long-term lung damage that you have for the rest of your life. And patients are susceptible to secondary infections of bacteria because you do have some bacteria that might take an opportunity to overgrow their normal um, amounts. And so sometimes you can get a secondary bacterial infection. All right. So that is all for chapter 25.